Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. Here are some of the highlights this hour. Federal government commits to supporting Nigerian businesses under coronavirus pandemic. Independent National Electoral Commission INEC reiterates voting procedures during the Edo elections, assures strict compliance to COVID-19 protocols. And Argentina breaks daily new infection record with almost 13,000 cases confirmed, pushing the country's total to more than 600,000 altogether. Do not ignore the virus symptoms as sudden loss of taste or smell, a cough or fever may be COVID-19. The Nigeria Center for Disease Control, while reminding Nigerians of the danger of the coronavirus, reported 131 new cases and 2 deaths in 24 hours. The new cases are reported from 17 states and the FCT, with Lagos recording the highest numbers at 45, and other states like Bauchi, Ebonyi, Katsina and Rivers recording 1 each. In Kaduna State, which recorded the second highest cases, the government's COVID-19 update report shows that while 9 patients are due for discharge, 17 samples tested positive out of 78 analyzed. The new cases are from Chikun, 13 were recorded there, and 2 each from Kaduna North and Zangon Kataf. In the meantime, global cases of the coronavirus is still rising, with the US leading, followed by India, Brazil, Russia and Peru as the top 5. In Africa, South Africa occupies number 8th position in the top 10 of the world's figures at over 650,000, while Nigeria occupies the 55th position in the world with total confirmed cases at 56,735. Now, news just coming in this evening says the Nigerian Institute of Medical Research at Yaba, Lagos, says that it has developed a molecular test kit for COVID-19. According to developers at the research institute, the kit gives test results in less than 40 minutes. They call it the SARS-CoV-2 Isothermal Molecular Assay, SIMA. According to the Institute's Director General, Professor Babatunde Salako, the test kit is for COVID-19 detection and is Nigeria's first molecular testing kit for the contagion.
It's a question of having your money and buying the isothermal PCR, which at the time we bought the one that we used for this test was around $10,000 compared to the real qPCR that the bigger laboratories are using that may cost up to $100,000. Although it depends on the number of tests that you want it to be able to do, even then it cannot be less than between $50,000 and $100,000. Now this will just be $10,000 and can do 32 tests in less than 40 minutes. So it's something that will be very useful for those hospitals, and I believe they should be able to invest in such things. 500 kits. This is low because in the past few weeks when we were trying to develop this, we had issues with transportation. There were international lockdown. The planes were not flying. And bringing some things to the country became very costly. So we had to wait. In fact, there are some of our enzymes that we are still expecting that have not come. Given the current situation where we cannot get what we want, we should be able to produce as much as possible. But our aim really is to make it very fine and then get someone to take it over from us.
The federal government is committed to creating an enabling environment to help Nigerian businesses get back on track following the impact of the coronavirus pandemic. According to Vice President Professor Yemi Osinbajo, the micro, small and medium-term enterprises, MSMEs, he offered the assurance that government's economic sustainability plan is still very much on course. He was speaking during the virtual commissioning of the MSME facility in Lagos.
This year, 2020, has been a difficult one for the entire world. as a result of the COVID-19 pandemic. And it, of course, has been a very difficult one for Nigerian businesses as well. Businesses, small and large, have been significantly impacted by the disruptions. As you all know, MSMEs are the engine of the Nigerian economy. When they thrive, the economy thrives. When they struggle, the economy struggles. This is why the federal government is deeply committed to ensuring that we incrementally create the best possible environment for MSMEs to do well. The administration is doing this in various ways, from improving access to credit through the central bank, Development Bank of Nigeria and the Bank of Industry, and others. Several of our development banks and several of even our commercial banks are being committed to ensuring access to capital for small businesses. And there are several initiatives that have also supported small businesses in various ways. For example, our Finance Act has exempted businesses generating less than 25 million naira in annual turnover from companies' income tax. Those with a turnover of between 25 million and 100 million will only pay 20% in corporate income tax instead of 30%, which was the former rate payable.
And with just hours to the governorship election in Edo State, the Independent National Electoral Commission, INEC, has reiterated the method of voting in compliance with the established COVID-19 protocols. Briefing journalists in Benin, the state capital, the INEC resident electoral commissioner, Mr. Johnson Alalibo, also clarified on other issues on preparations for the poll.
As we started preparing for the elections, INEC, in this wisdom, developed a guideline on conducting election under the context of COVID-19. And that guideline will guide us on the safety of both personnel and voters. And we have done enough to sensitize all our stakeholders and the voters on the guideline. First, on how we are using face masks. It's compulsory for both the personnel and the voters. And we are using sanitizers to sanitize our smart card readers. We also have methylated spirits to clean it, our smart card reader after each use. We also have told the voters that you are going to have two queues, the inner queue and the outer queue, and we are going to maintain physical and social distance of 2 meters or 6 feet. And the inner queue will have maximum of 20 persons at a time. So these are some of the measures that we have put in place to ensure that we are safe while we vote for this governorship election by tomorrow.
The UN Resident and Humanitarian Coordinator in Nigeria, Mr. Edward Kalon, has been speaking on the decline in the number of confirmed cases of COVID-19 in Nigeria. During a meeting with the governor of Borno State, he said the decline is indicative of a collapse in demand for testing. He believes that community transmission is already ongoing, urging governments to intensify campaigns that will ensure compliance to the safety guidelines.
The pandemic is going to be with us for a long time, until a vaccine is found. Don't even start talking about the politics of the vaccine, which you are all familiar with every day. The decline in the number of confirmed cases is indicative to us as a collapse in demand for testing, and from our analysis has not got anything to do with containment of the virus with ongoing community transmission. I call on Your Excellency and members of the Executive Board to lead by example in containing the virus and hold institutions and organizations accountable to ensure compliance with the non-pharmaceutical measures. I am on this mission with the WHO representative, and the advice of WHO to governments and people is clear, and I quote, Your Excellency: test, isolate, and treat COVID-19 patients, trace and quarantine their contacts, inform, empower, and listen to communities. Keep physical distance, wear a mask, clean hands regularly, and cough safely from others. WHO has also gone further and advising governments to tackle the pandemic. They are urging us to focus on 4 priorities. 1, prevent amplifying events such as large crowds or crowded places. empower people to protect themselves, focus on public health basics, and protect the vulnerable, including older people and those with underlying conditions.
Ways which we can flatten the curve. Joining us in the studio is Dr. Femi Adewale. He is a volunteer doctor. He's worked as a medical officer, Mainland Infectious Diseases Hospital, Yaba Isolation Center. Thank you for joining us on the program.
Yes, good evening.
All right. So first tell us what it was like to volunteer as a medical officer during this period.
It was a mix of emotions, definitely, because the first thing I had to ask myself was, was I willing to work at the ground zero where you're sure there are confirmed cases? And it took a while, and probably like 2 months before I could convince myself, get my wife to concede, because I knew that it wasn't just me alone, but it involved the entire family. So working at the isolation center was a mix of emotions. There were beautiful days, there were bad days, there were days we were sad, there were times that we had immense victory. So it was us up and downs, but thankfully there were more good days than bad days. So
if we were to paint a picture as to what an isolation ward looks like, especially during the heat of the pandemic.
Okay, so the isolation center had some suspect wards, which were single room, and there were now the confirmed patient wards that had 20 to 30 patients. So if someone came in with symptoms that were suggestive of COVID-19, we put them in the suspect ward and tested them and fast-tracked the test. And those that came out positive were moved into the confirmed ward, and those who were negative were referred to the appropriate center. So during the heat of the program, everywhere was maxed out. We had the entire mainland isolation center full. We even had to be referring people to a few other auxiliary isolation centers. So then it was a lot of stress on the medical team. It was a lot of stress on everybody to even have to tell people that we don't have space. It was heartbreaking because some of them you weren't even sure if they would make it to the next hospital. So, but thankfully that has come and gone, and the numbers have steadily been declining. And I think things are a lot better now.
Before I come to your thoughts on what you think is happening with our daily count, for you as a medical health officer, I mean, did it affect you in any way? And did people stigmatize or discriminate because you worked in an infectious diseases center?
As long as you're human, if you are in that scenario, you definitely will be stigmatized. You definitely will have those strong emotions. I've had to see someone pass right in front of me. There was a particular patient that the wife came with the man, and I knew his chances were slim. So before taking him into the ward, I had to tell the wife that I give you guys like 5 minutes, just talk, pray together, and we hope for the best. Unfortunately, he passed on 4 days after, but the wife still calls me and thanks me that I just give them that special moment. So it's a mix of emotions. You feel, there are times you even ask yourself what you could have done. So it's a lot to pass through emotionally. So those on the ground zero, those working in isolation center, from doctors to nurses, even to the security men, they go through a lot, and I believe they are all heroes.
So in one sentence, your advice to Nigerians who also think it's still a scam?
COVID-19 is real. You don't have to be a victim to know it. It is real. You need to stay safe. You need to follow the protocol, and you need to help others to stay safe. Thank you.
I'd like to thank you so much, Dr. Femi Adewale, volunteer doctor, medical officer. Thank you for joining us on the program.
It's a pleasure.
We have more of the COVID-19 updates when we return. Please stay with us. Welcome back. In Ogun State, as students of tertiary institutions prepare to resume academic activities, a one-day sensitization on COVID-19 pandemic has been held for school administrators to be on the same page to control and manage COVID-19. At an event which held at the Valley View Government House, Abeokuta, the state capital, students were also asked to take responsibility to halt community spread.
Having this sensitization to prepare them on how they can assess risks, on how they can understand how they can modify some of their programs such that as much as possible the ones that can be done virtually are done virtually, the one that there's limitation of gathering of people together, and also as much as possible they're aware of the signs and symptoms of COVID-19. Their major responsibilities are that they should identify the signs, early signs. They should know that the COVID-19 is not a death sentence. They should not stigmatize anybody that is COVID-19 positive. They should, as much as possible, also be able to support their trainers and all that when they make requests for smaller numbers of people in classes and physical distancing, and also to ensure that as many people as possible do not, they can do the risk assessment and modify as much as possible. Thank you.
The global number of COVID-19 patients passed 30 million this week, and the virus is expected to pick up momentum with the ease of lockdown restrictions. Now, as scientists around the world strive to develop an effective vaccine against the disease, how far are we? Mr. Stephen Chubiyojo is a pharmacist, specialist drug quality control and drug production coordinator of Global Health Network Research for Clinical Trials at UATH. He joins us from Abuja. Thank you for joining us on the program.
Thank you. Good evening.
Good evening. How soon do you expect a vaccine for COVID-19? We're hearing some countries like China says 4 vaccines are in phase 3 clinical trial, and Russia is also taking part in a 3rd phase of the trials.
The development of vaccine is a very cumbersome issue. Drug development generally all over the world, it's not a straightforward process. It's interesting that at this point we have about 201 companies working on vaccine already, and a lot of them are in phase 3 development. You know, in drug development we have phase 1, phase 2, phase 3. So I think it cannot be sooner than January or February 2001. The reason being that the gold standard for producing vaccine is safety. And once safety is not established, the vaccine is not allowed to be released into the market, no matter how urgent the situation might be. Taking a classical example with what happened with AstraZeneca, a British-Swedish pharmaceutical company that is collaborating with Oxford University to produce vaccine against COVID-19. In their clinical trial phase 3, they had one patient, just one patient, has severe adverse drug reaction to the vaccine. They had to withdraw that experimental vaccine from the market, stop the clinical trial, went back to their laboratory, made some adjustment before they came and continued the clinical trial. So you can see that it cannot be sooner than January 2021.
I want to ask about homegrown remedies, especially in Africa. I mean, is Africa looking at indigenous medicines that can fight COVID-19?
Really, very practically, we're like the Plateau State government did very well by inaugurating a committee headed by Professor Wanang, a pharmacist, to look into our indigenous African herbs to see if we can get some that are active against the coronavirus. And very interestingly, in history, we know we have some herbs that have antiviral properties. And then this group in Jos have already gone into work, and they discovered there are some herbs that have activities against the coronavirus. And they are doing a very good job, and I know very soon this product will be available. And as a pharmacist, we are also saying that it is very important for us to look inward, to look at our indigenous plant, those that have these activities, to be mass-produced and made available for people to use. A lot of these herbs, they modulate our immune system. Modulation of immune system means improving our immune system. And once the immune system is highly improved, I tell you the truth, you will be able to fight the coronavirus with high degree of resistance. Today we are looking at coronavirus. Previously we looked at Ebola virus. Today is coronavirus. Tomorrow another virus can come up. So I think it should be a way of life for us Africans to look at our herbs. Instead of using ordinary tea, we will use ginger tea. Instead of using ordinary seasoning, we use turmeric. And that will help to improve our immune system and help us to fight against foreign diseases.
All right, we appreciate your time on the program. Mr. Stephen Chibigobo, a clinical pharmacist, specialist drug control and drug production. Thank you for joining us on the program.
Thank you. It's a pleasure. Thank you. All right.
According to reports, there are signs in Latin America that the pandemic's epicenter is moving to Argentina. The country broke its daily new infection record with almost 13,000 cases recorded, pushing the country's total to more than 600,000. In total, a nationwide lockdown introduced in March still remains in place, although from late August, groups of 10 have been allowed to meet outside and some restaurants able to operate. Here's more on the global update.
The Jewish New Year is traditionally a time for big, festive get-togethers, but a new COVID-19 lockdown means celebrations in Israel will be muted. Under the new restrictions, Israelis must stay within 1 kilometer of their homes, with exceptions for activities such as commuting to work, shopping for essential items, and walking outdoors for exercise. Social distancing rules also greatly restrict numbers allowed in synagogues.
Israeli National Police are implementing a full lockdown across the country from the north to the south. Inside cities and different neighborhoods, more than 7,000 police officers involved in implementing health measures, preventing movements of up to 1 kilometer. And these rules and regulations will continue until the 11th of the month, in another 3 weeks' time, in order to prevent the spread of COVID-19 across the country.
With the new COVID-19 cases in Israel reaching over 6,000, a record high on Thursday, it has one of the highest infection rates in the world. Meanwhile, with cases spiking around Europe, some areas are implementing new restrictions to fight the pandemic. The British government has announced further restrictions for certain parts of England, including the Northwest, West Yorkshire and Midlands, to tackle rising COVID-19 infection rates. Residents from these areas will be banned from socializing with people outside of their households and support bubble from Tuesday. Health Secretary Matt Hancock says that UK faces a very serious situation and does not rule out another lockdown.
Well, we have seen an acceleration in the number of cases over the last couple of weeks, and we've also sadly seen that the number of people hospitalized with coronavirus is doubling about every 8 days. So we do need to take action.
And in France, local authorities in Nice have banned public gatherings of more than 10 people on beaches and in parks as part of the new measures to fight the spread of the virus. All bars and restaurants will have to close their doors at 12:30 a.m. and all visits in public care homes have been suspended. The World Health Organization has warned that the coronavirus cases are surging alarmingly in Europe, and weekly cases are now more than those reported at the peak of the pandemic.
You're watching Channels Television, your home for the news. For further updates on the pandemic, take a look at our website. It has all that you need. That's channelstv.com. It's at your fingertips. That's the program this evening. Thank you for watching. I'm Millicent Nwaka. Stay safe.